Okay, so my topic was stress and anxiety. So what exactly is anxiety? The definition is frequent negative emotional states characterized by feelings of worry and apprehension and accompanied by specific somatic, cognitive, and behavioral manifestations. So if anxiety is severe enough, it can affect all aspects of life. So it impairs functioning, it decreases the quality of life and well-being, and it can interfere with job performance, school performance, and even relationships. There are a lot of different types of anxiety. So just to name a few, there's general anxiety disorder, or GAD, panic disorder, social anxiety disorder, obsessive compulsive disorder, which is often known as OCD, post-traumatic stress disorder, so PTSD, and phobias. So what I decided to do was take the top 3 most common types of anxiety, which include general anxiety disorder, panic disorder, and social anxiety disorder, and just talk about the signs and symptoms of those. So someone with general anxiety disorder might feel on edge a lot of the time and also more easily fatigued. They'll have a hard time concentrating and they might feel really irritable. They can have muscular tension. So this is often feeling really tense in the shoulders or upper back and often having knots. They might feel more worried or anxious, and they might have sleeping issues, which include sleeping too little and too much. So someone with panic disorder will have repeated attacks of intense fear, and they'll feel out of control during their panic attack. Then they have intense worries of when the next attack will happen, and this tends to consume their thoughts. And they'll start avoiding places where panic attacks have happened in the past, which tends to lead to isolation. And social anxiety disorder is someone who feels anxious about being around people or talking to them. They'll feel self-conscious around people. They'll be afraid of being humiliated, embarrassed, rejected, or offending others. And they'll stay away from where people are. They'll have a hard time making friends and keeping them. And some physical signs and symptoms of social anxiety disorder is blushing, sweating, trembling, feeling nauseous, or even sick to your stomach when people are around. So the pathophysiology of anxiety is pretty much just a disrupted regulation of the central nervous system. So someone with anxiety has chemical imbalances in their brain. So these imbalances lead to a heightened sympathetic arousal. So someone with anxiety will have an underactivation of serotonergic receptors and an overactivation of noradrenergic receptors. So serotonergic receptors will receive serotonin, and serotonin is known for contributing to happiness. So someone that has an underactivation of these receptors will have a decreased mood because serotonin isn't being transmitted in the brain. And an overactivation of the noradrenergic receptors just means that someone with anxiety has more catecholamines, norepinephrine and epinephrine, circulating in their brain, which can lead to feelings of anxiousness. So this is a dysregulation of the body physiologically and emotionally, like I said before, because serotonin is contributed to happiness. So another chemical imbalance that someone with anxiety might have is a disruption of gamma-aminobutyric acid, which is GABA for short. So GABA is known for reducing fear and anxiety. So someone who has too little of this amino acid in their amygdala will have anxiety-related responses. So there are different risk factors for anxiety. These are the ones that I found most interesting. So being introverted leads to more prevalence of anxiety. Being female actually leads to more prevalence also. Having little or low economic resources and being divorced or widowed. Stressful life events in your childhood and adulthood can lead to anxiety, and if you have a family history of any anxiety disorders. And this is the one that I found most interesting. High levels of cortisol in the saliva during the afternoon can imply that you have an anxiety disorder. So there are a lot of different treatments for anxiety. You can take medication, but you can also go to therapy for it. So I decided to talk about both. So the medications for anxiety include antidepressants, anti-anxiety, and beta blockers. So the antidepressants might take several weeks to start working and can cause side effects like headaches, nausea, or difficulty sleeping. And the most important one is that antidepressants can oftentimes lead to suicidal thoughts and attempts. So you have to be really careful with taking antidepressants with anxiety. The anti-anxiety medications help with anxiety disorders, so it reduces anxiety, it reduces panic attacks, and feeling extreme fear or worry. On the right, there's some anti-anxiety medications that are listed, like Ativan, Valium, and Xanax. And you can also take beta blockers for the physical signs of anxiety, which include your heart racing, trembling, or shaking. So something that I found really interesting was that this is from the National Institute of Mental Health in 2005, but it says that people aged 30 to 44 have the most prevalence of social anxiety disorder. So another way to treat stress and anxiety is through therapy. So psychotherapy is directed at the person's specific anxieties and tailored to his or her needs. Cognitive behavioral therapy is it teaches a person a different way of thinking, behaving, and reacting towards anxiety-provoked situations. So there's two different parts of cognitive behavioral therapy, and they include cognitive therapy, which neutralizes unhelpful thoughts, and exposure therapy, which is when the therapist encourages the patient to engage in more situations that might be anxiety-provoking to help confront their fears. Another treatment of anxiety is self-help or support groups. So this is when people share their problems with other people that are going through the same things, and this can help provide support. And some stress management techniques. These are just some things that you can do to reduce anxiety, which include avoiding caffeine and aerobic exercise, which we'll actually talk about later. So anxiety is really important, and exercise is used as medicine. So with anxiety, physical activity can help relieve and reduce symptoms of anxiety and promote the metabolic function. And exercise is correlated with physical improvements, higher self-efficacy, more social support, and less anxiety barriers. And moderate to vigorous physical activity can improve your well-being. So my case study is Jen. She's 21 and she's a full-time college student. She has general anxiety disorder and is really stressed out about the workload of her classes. She's swamped with schoolwork and doesn't really have time to work out, so she doesn't get the recommended exercise prescription for a healthy individual. She doesn't smoke. She's 5'4" and 130 pounds, which means that her BMI is 22. Her parents are both healthy individuals and so show no signs of cardiovascular disease. She went to the doctor and her blood pressure was taken at 126/72, and lab results were processed and she found out that her fasting plasma glucose was 80. Her LDL measurement was 125, her HDL was 33, and her total was 158 milligrams per deciliter. Her triglycerides were 120. So some things that she wants to do in her exercise program is to live a more active and healthy lifestyle because she heard that exercising can help reduce anxiety, and she also wants to become more toned. So her age is not a risk factor, and also non-smoking, her BMI, her blood pressure, genetics, LDL, total cholesterol, fasting plasma glucose, and triglycerides are all not risk factors. So her being sedentary and her HDLs being 33, they're both risk factors. So she has 2 risk factors and she's moderate risk. So for exercise testing, I decided to do a 10RM test on bicep curls, squat, shoulder press, and lat pull down. For cardiovascular testing, I decided to do a mile walk run test and a bike ergometer test. And flexibility is a sit and reach test. So it's important during exercise testing to ask about medications because she can be on a beta blocker that can reduce her heart rate during exercise, which will affect her results. So just a general thing about anxiety and exercise prescription. So as someone who's providing information about exercising, you want to provide the patient with means of coping with stressful life events and give them the knowledge of benefiting from physical activity and giving them a sense of self-efficacy. These things should all be included in their prescription. And it's really important to encourage your client and keep them motivated throughout their prescription and to help them overcome barriers and keep them motivated. So for her aerobic exercise, since she's sedentary, she can start at 3 days, but we want to work up to 5 days a week. On Monday, Wednesday, and Friday, we're going to do 50 to 70% of her VO2 max. And on Tuesdays and Thursdays, we're going to do 40 to 60%. So these correlate to moderate and vigorous activities. She's going to do it for 45 minutes per day, which include warm-up and a cool-down. And she's going to do activities that she enjoys. So some aerobic exercises listed are walking, running, swimming, and cycling. For resistance prescription, we're going to work up to 3 days a week. Right now she can start at 2 because she is sedentary. So she's going to do 10 to 12 reps for body toning, and she wants to do 3 sets of each exercise and up to 8 exercises per day. She's going to do free weights, including major muscle groups, so she can do squats, lat pull downs, bicep curls, shoulder press, core work, and I included single arm and leg exercises to incorporate balance. So her flexibility exercise prescription is, again, working up to 5 days a week, and she's going to do dynamic stretching before, during her warm-up, and static stretching after, during her cool down. She's going to hold the stretch right before discomfort, and she's going to hold each one for 30 seconds per stretch and repeat each stretch 3 different times. So she can also do yoga and Tai Chi, which is really good for balance, flexibility, and helping someone with anxiety relax and just focus on mindfulness. So this is my exercise prescription, and these are my references that I used for this project.